Welcome to Azad Bioacademy. Today I will talk about allergy. That means type 1 hypersensitivity reaction. We have a video regarding drug allergy, different types of drug allergy in my YouTube channel. But this video is going to be only for the allergy purpose. How allergy occur, that means pathophysiology of allergy and the details pathway. Okay, so firstly, I will say what does it mean allergy? Allergy means it's a overactivation of your immune system or immune cell to a very harmless substance, very innocent substance when enter in your body, and unfortunately, your immune cell will overreact to the harmless substance, and this is called allergy. It's very possible when any antigen or pathogenic substances or toxic substances will enter in your body, your immune system will be alert to just engulf it or destroy it. Is very possible, and this is called immunological reaction. And in a certain extent, you can say in a particular way that is the inflammation to prevent entry pathogenic substance into the body. But allergy is the very overactivity of your immune system. That means, already I said, when any harmless substance will enter, and unfortunately, your immune cell will recognize it as a harmful substance, and then it will arrange a very long event to destroy it. But actually, this is harmless. So this is called allergy. So how allergy occur? I will just explain step by step, and for just saving time, I just try to draw a very complex structure, but no worry, I will explain stepwise very clearly. So stay with me. So firstly, uh, allergen entry. So what does it mean, allergen? Allergen means any substances, basically, protein in nature substances, which can cause allergy. That is called allergen. It's also an antigen, but not like the pathogenic antigen. Pathogenic antigen has some pattern recognition molecule or pattern recognition receptor, and that will make distinction from allergen to pathogenic antigen. So allergen is also antigen, but it does not carry any pattern recognition molecule, or it's not as like harmful of your pathogenic substances. So allergen means which causes allergy, the substances, the antigen. Okay, that can be from your dust, that can be from your food, or you can say that can be from your flower, pollen, like that. Very harmless substance, but it can cause allergy. So that is called allergen. So first stage is allergen entry. Allergen will enter into your body through your respiratory tract, through your GI tract, or through your skin. Okay, it has a barrier, it has mucus or epithelial barrier, epithelial layer that will prevent all the unnecessary substance, act as a primary barrier. But allergen, suppose dust, this is very silly matter, dust, the home dust. But this dust can carry the protein that can degrade the epithelial layer. So come to the point here, allergen entry. That means, this is, I marked, I just try to draw here. This is the epithelial barrier, this one, that epithelial cell. Okay, and this has a tight junction. That epithelial barrier, this is the red mark is your antigen allergen. That allergen can be soluble and that can enter into inside the body through the epithelial layer. That can be, this allergen can be protease like substance, and that can degrade the epithelial layer. And sometimes you're just beneath the epithelial layer, antigen presenting cell or macrophage are there, and that can protrude through the epithelial layer, and that can activate the dendritic cell. Okay, so allergen can enter in your body through the skin, respiratory tract, or gut by just changing structure of the epithelial, or it can easily cross as a soluble substance, or sometimes dendritic cell can pass through the epithelial layer and can be activated by the allergen. Okay, so naturally these are present here. But what will happen when allergen will enter or allergen will be inside the cell, inside the body? Then what will happen? This allergen, when activate the epithelial layer, epithelial cell, that epithelial cell instantly will produce some substances, and that will create an alarming situation. Oh, something wrong, something negative substances are just try to enter into the body, and they will secrete some substances, and that substances are basically I mentioned here, that is TSLP, that is thiamine stromal lymphopoietin, that is TSLP. This is highly alarm causing agent for allergy, mostly responsible for causing allergic alarm, allergic signal. Okay, and also that epithelial cell can produce IL, interleukin 25, interleukin 33. These are alarmin, right? So that will be produced by the epithelial barrier, and also it has some macrophages that can produce also some alarmin, that is tumor necrosis factor or interleukin, interleukin 1 beta. These are the also alarmin. Okay, so what will happen when allergen will try to enter? Then epithelial cell and your macrophage will produce alarmin, and that alarmin will activate the your dendritic cell. This is your dendritic cell, that is DC. You can call it as an antigen presenting cell. Okay, so this is present just beneath the or below the epithelial barrier. Okay, so that is the antigen presenting cell activation. So first phase is an allergen entry. Now come to the second phase, that is activation and maturation of DC, that is dendritic cell. So activation, already I said that alarmin will activate the antigen presenting cell, that is dendritic cell, and it will make the dendritic cell matured. So how matured dendritic cell will be produced? That is maturity, that means dendritic cell will express some substances on the surface of the dendritic cell. That means dendritic cell will express something, and that will be matured. So it will express some substances, that is your MHC molecule. That means major histocompatibility complex, and this is the major histocompatibility complex. This one, and that the main function of this MHC2 is to just express the antigen to the T cell. So this is the MHC molecule, that is MHC2, and this one is MHC2, and this red mark is allergen. Okay, here it also produces some granular substances. That means you can say CD80 cluster molecule or CD86, and more specifically or highly specific substance, that is CCR7, and that is your chemokine receptor CCR7. That receptor will be expressed on the surface of the dendritic cell, and that dendritic cell will be matured. That means when alarmin will activate the dendritic cell, and then dendritic cell will be matured through expression of major histocompatibility complex 2, that is MHC molecule 2, CD80, CD86, and more specifically CCR7. Okay, so that then it will be matured, and that matured dendritic cell will also produce the MMP, that is matrix metalloproteinase. Okay, that matrix metalloproteinase. How to the function of matrix metalloproteinase? I will explain later on. So this is the part 2, that is activation and maturation of dendritic cell. Okay, so already you got the mature dendritic cell. Now the third part, migration of dendritic cell to the lymph node. You know, the lymphatic system, lymph node is the meeting center of your immunocell system. So the main target of your dendritic cell to present the antigen or allergen to the meeting center, to the T cell. How? Just come to the point. So it will migrate from that area to the lymph node area, towards the lymph node area. So who will help it? So different substance, that is dendritic cell itself will secrete MMP, that is matrix metalloproteinase, and that matrix metalloproteinase will clean up, will cut off the extracellular matrix, and that will just create a way through which the dendritic cell will just go towards the lymphatic system. So peripheral lymphatic vessel are there in skin, in your gut, in your respiratory tract. The lymphatic system, lymphatic pathway there. So lymphatic vessel has a endothelial lymphatic endothelial cell. These are as like your blood vessel. Your blood vessel inner layer has endothelium. So the lymphatic endothelial cell will produce CCL21. CCL21 is chemokine 21, and that will be produced by peripheral lymphatic endothelial cell, and that will come out from here, and that can activate the dendritic cell. Okay, you know, that CCL21 will be produced by endothelial lymphatic cell. So, of course, inside the endothelium, CCL will be more. So, that will just push the dendritic cell towards the lymphatic vessel. Okay, so matrix metalloproteinase will create the way, and CCL21 will attract, or it will just push toward the lymphatic system. Okay, so the dendritic cell, which already matured, that will enter into the lymphatic system, lymphatic vessel. Okay, and within your lymphatic vessel, it has also fibroblastic reticular cell that will produce CCL19 inside the lymph node. Okay, and that will altogether CCL21 and CCL19, that will direct the dendritic cell to the lymph node. And this is the lymphatic peripheral lymphatic vessel, and this is the lymph node. Here is the lymph node. Okay, so that lymph node carry the naive T cell. You know, the T cell will basically produce from bone marrow, and it will be trained up in your thymus. That will train up by recognize self antigen, and then it will just go the peripheral lymphatic system, lymphatic pathway. That is the lymph node. So here, the naive T cell is present. So what will happen when the dendritic cell, mature dendritic cell, enter into the T cell zone of the lymph node? The naive T cell will be activated. How naive T cell will be activated? That is the very interesting thing. Already I said, when the dendritic cell, that is already said, the dendritic cell, this is the dendritic cell, black color as like this one or this one, that will express the MHC2. This is the MHC2, and it will present the antigen, and this is the antigen. Okay, trademark antigen. That is like this, and that will, this is your MHC2, and this one is antigen. So this is the DC, dendritic cell, and that dendritic cell will present antigen through the MHC2 molecule to the naive T cell. Okay, so naive T cell will be activated and it will convert into different type of T cell, that can be cytotoxic T cell, suppressor T cell, memory T cell. Here, in our allergic pathway, it will turn into helper T cell 2. This is your helper T cell 2. This is helper T cell 2, right? This helper T cell 2 will actually come from the naive T cell. That means naive T cell will turn into helper T cell 2 along with other T cell. This part is allergen presentation to T cell and T cell activation. Okay, you can say T cell activation and allergen presentation. So this part. And now you can go for the B cell activation and antibody production, that is IgE production. So what does it mean? The helper T cell will produce the interleukin 4, interleukin 5, interleukin 13. 4, 5, and 13 specifically connected to the allergic issues. So that interleukin will activate the B cell. Here is the B cell. Okay, this is the B cell. And it can also activate the basophil, okay, for allergic reaction. So normally, any substance, allergen or antigen will enter, and that will happen very normal way. B cell will be activated, and B cell will produce antibody, and that antibody will just act against the antigen. Okay, or it can activate the mast cell, and mast cell will produce histamine, and that histamine will arrange a multiple number of immunocell, and that will help the immune system. That you can call immunological reaction or inflammatory reaction. That is a very normal phenomenon. But when it will be allergic or when it will cause allergic reaction, that is the issue. So this is the normal process. But when allergy will produce, that same allergen will exposure the second time. How? When the B cell will be activated by the interleukin 4, 5, or 13, that B cell can turn into plasma B cell. The plasma B cell, I will say this is plasma B cell, and that plasma will produce antibody. That is IgE antibody. IgE. And that B cell can also convert into memory B cell. So that is memory B cell. And this is the main way. This is the main cause to cause allergy for further exposure. That B cell will be inside your bone marrow or your lymphatic pathway, lymph node. It will be there and it will wait for second exposure, because that memory B cell has distinction capacity to recognize that allergen. Because of that allergen, that antibody is produced basically. So this is the memory B cell that has memory to recognize the allergen. Okay, has a specific membrane arrangement antibody production. Okay, so this is the memory B cell. So when second exposure will occur, so firstly the B cell activation and Ig production. That means cytokine will activate the B cell, and B cell turn into plasma cell, and it will produce antibody. Okay, so this is the B cell activation and IgE production. And now is the last phase, that is effect. So, so this is the fifth phase, that is B cell activation and IgE production, and this is called sensitization phase. So allergic reactions, here the basic part, one of the major part is sensitization phase. So of course your IgE production must be there. And then finally your effector phase, or you can say immediate reaction phase, or that will happen only after second exposure or re-exposure of the same allergen. Okay, so what will happen? When second exposure will occur, instantly your memory B cell is ready to recognize that allergen, and it will turn into plasma B cell, and that will produce antibody. Okay, so this antibody is IgE antibody. Already I said, and that IgE antibody will bind with the mast cell. So this is mast cell. Okay, here is your mast cell, and mast cell has a surface receptor like that. This uh, blue color, this is your receptor, and that receptor is called Fc epsilon Ri. This is the receptor. Mast cell has that receptor, and the antibody will bind with that receptor. Okay, and already I said at that time your lean and Syk kinase pathway will activate, and it will arrange high intracellular calcium, and that will cause release of histamine. And histamine will arrange vasodilation and arrangement of immunocell inflammation like that, already I said. But what will happen when second exposure will happen and allergy will produce? How? That antibody will bind here like that and here. So this is the epsilon Ri receptor and bind with the antibody. Very adjacent to receptor is blocked by the antigen, and another antibody will, not antibody, and that antibody also bind here, and it will create a complex that is cross-linking to each other. Here, like that, your mast cell is like that, and your two adjacent receptor, that is Fc epsilon Ri, and here antibody will bind in that way, and that will make a cross link. When cross link will occur, and then the membrane protein will be activated, and then it will activate the lean-Syk kinase pathway. Okay, and that lean-Syk kinase pathway will increase the intracellular calcium. It has a long pathway, and that calcium will manage the histamine vesicle to rupture by priming, fusion like that, already you know, and it will produce histamine. These are the histamine. Okay, so mast cell will produce histamine, and that is one of the master molecule to cause allergic reaction, allergic expression. How? This histamine will bind with the blood vessel. So in which blood vessel? You can consider this part is considered as a arterial. Histamine bind with H1 receptor in arterial region, and it can cause vasodilation, and that will increase the blood flow, and it can cause redness. Okay, this is the redness. This is vasodilation. Okay, so where vasodilation will occur? In arterial region. Why? To increase the flow of blood to the affected area. Okay, and then arterial, then capillary, and then post-capillary venule. You can consider this steady area is post-capillary venule. Okay, and in that area, histamine will bind with the histamine receptor inside the endothelial cell, and then it will contract the endothelial cell, and it will create a leak, pore, and through this pore or leakage, the intravascular substance will come out, and it will deposit extracellular space, and it will cause exudation, swelling. Okay, that means histamine will bind with the histamine receptor in post capillary venule. Okay, capillary venule vein, capillary arteriole artery. So this postcapillary venule region is highly sensitive for the allergic reaction. Okay, main allergic reaction happens in the postcapillary venule region, where endothelial cell will just uh, contract and it will create a leakage, create a pore, and through this pore, blood substances will come out and it will cause swelling. Okay, so during allergic reaction, swelling happening. So this is one of the major part. So redness by arterial vasodilation, swelling by your postcapillary venular contractile leakage, and also that histamine will bind with the nerve ending, the C fiber nerve ending, highly sensitive part of the nerve, and histamine will bind with that area and it will highly activate the nervous system, and you will feel some irritation that is called itching. So that will cause itching. So when someone will suffering from allergy, itching, hypersensitivity, that is also redness, swelling, is are the very common sign and symptom. So when such things will happen in your respiratory tract, you will sneeze, you will secrete some substances. When it will occur in your skin, then you will feel itching or redness or swell up. So this is the allergy. So which one is mainly responsible for causing allergy? Is it allergen itself? Of course. If no allergen, so no such events will be. So allergen is one of the factor. So when you will suffer from dust allergy, your home dust. So home dust carry the protein like some protein substances that can harm the epithelial layer. So you have to prevent yourself from your home dust. You have to free your home from dust, or you can use mask. Okay. Also, if you think you are suffering from food allergy, so specific food you have to avoid. No other way, because your immunocell is uh, mistakenly consider harmless substance as a harmful substance. Okay, so no way to go against this, your defense system. Okay, so you have to avoid your food, different type of food on which you have some allergic reaction. Okay, another things you can consider as a IgE, that is antibody. So IgE antibody, you have to suppress your immune system. Immunosuppressing agent you can take. Okay, some steroidal drugs you can take to suppress the inflammatory substance production or your antibody production. So this is one of the things. Nowadays monoclonal antibodies are different. Particular drugs already in the market which can inhibit the IgE. Also, you can think about mast cell desensitization. You have to suppress the mast cell. You have to inhibit the mast cell activation. This is the another way. And finally, the antihistamine. That is H1 blocker, antihistamine. So when you will block the histamine, then it will prevent vasodilation in your arterial region. It will prevent the post-capillary venular leakage. It will inhibit the C fiber nerve ending hyperactivation, that is itching. So that is the allergic matter. So allergen will enter, then your dendritic cell will be activated by your alarmin that will be produced by epithelial cell or local macrophage, and then your dendritic cell will be activated and finally it will be matured and it will express on the surface uh, your MHC molecule 2, CD80, CD86, and also CCR7. And then it will secrete matrix metalloproteinase, MMP, and then it will go towards the lymphatic, peripheral lymphatic vessel, and then finally it will enter into the lymph node by the help of your CCL 21 and finally CCL 19, and all together inside the lymph node. And finally it will meet with the naive T cell. And antigen presenting cell, that is dendritic cell, will present the allergen through the MHC molecule 2 to the naive T cell, and then naive T cell will be turned into helper T cell 2, and that helper T cell 2 will produce interleukin 4, interleukin 5, interleukin 13, and that will activate your B cell, and that can turn into plasma, and it will produce antibody, that is IgE, and it can also activate the basophil. And finally, what will happen? The antibody will bind with the mast cell on the surface receptor Fc epsilon Ri, and it will, during second exposure, it will make a cross link and it will activate the syn-sync kinase pathway, and it will increase the intracellular calcium, and that will rupture the histamine vesicle, and it will release the histamine or other protease or inflammatory substance like prostaglandin. And that histamine can cause vasodilation, vessel leakage, and nerve cell ending C fiber hyperactivation, that is itching. So this is all about. And when it will persist, your memory B cell will be there, and also your interleukins will activate the eosinophil, and that will cause the chronic allergic problem. Okay, so this is all about the allergy and allergic pathophysiology. So thank you very much.